Hello, everyone, and thank you very much for joining me today for this presentation. I'm Teena Mehta Aziz. I work as a behavior analyst with Spark Life Care. Just to give you a little background on who I am, I completed my master's in counseling with a concentration in applied behavior analysis in 2010, and I wrote my board exam to become certified as a behavior analyst in 2011. And a little bit about my work history. I've been working with Spark for about a year. I've also worked in the private world in a center for children with autism for about 6 months. Prior to that, I was working at Auto Children's Treatment Center, which with CHIO, as a behavior consultant for well over 18 years. And so I come from a background of quite a bit of experience in the field. I've also worked in group homes. I've worked as an instructor therapist and rehabilitation therapist for individuals with acquired brain injuries. So that's a little bit of a background on myself. So this evening, I'm going to just give you a little bit of a bit more information about what applied behavior analysis is. I think when I started the private world, just back in March 2022, I slowly kind of realized that I think there's this thought that autism and ABA are synonymous, and that ABA really can't go beyond autism and is very specific in how it needs to be done. So I thought maybe I would just provide this little presentation to just give people an overview of what ABA is about and how it can look, as it really is very different and can vary for each individual. So just a little bit of background on what a BCBA is. A BCBA is somebody who has to have a master's degree in a related area. So it could be Masters of Applied Disabilities, Masters in ABA, and as I mentioned, I did one in Masters in Counseling with a concentration in Applied Behavior Analysis. We all have to go through some supervised hours, which is about 1,500 hours. And then even after we get licensed as a board certified, the current criteria is, I believe it's about 3,000 hours of supervision by a BCBA or a BCBA-D, which is somebody who has a PhD. And so we're very well regulated, and we have extensive training and knowledge that really helps us be effective in the field. There can also be somebody who has a designation of a BCABA, which is somebody who has a bachelor's degree, has 1,000 hours of supervision experience, and they need to continue to be supervised by a BCBA or BCBAD if they are providing services to an individual. RBTs it's a fairly new designation over the last few years, and it's not always required. But as a field, we are looking at regulating all clinicians in our field to make sure that we're providing effective service, and our individuals are very well trained and know what they're doing. So this individual can just have a high school diploma, but they have to complete 40 hours of training, and they go through a complete background check. They do a competency exam, and they're always overseen by a BCBA, a BCBAD, or a BCABA. Okay, so and BCBA, as I mentioned, we follow a very strict ethical code. This is part of our educational background and experience, and it's rules and regulations that we have to abide by. Like any other field, like psychology or speech pathologists, we have certain ethical codes that we are bound to and must follow. And currently, behavior analysts are not regulated in Ontario. Anybody who does have their BCBA designation, they're overseen and regulated through a body in the United States. And we have to maintain our certification and renew it every couple of years, and maintain certain educational units. So keeping up to date on current trends in the field, and just making sure that our knowledge and skill base is up to date. And Ontario is looking to move towards regulating the field. They are looking at maybe potentially collaborating and connecting with the College of Psychologists. When this will happen and how it'll look like is yet to be determined and is all in the works, but hopefully there'll be some great things coming out of that. Okay, so what is ABA and what isn't it? ABA is based on, there's theory, there's experimental analysis of those theories and application of it. The theories themselves are really looking at and based on the field of behaviorism, which is the idea that all behaviors are learned through interactions with the environment. And this learning theory states that behaviors are learned from the environment. And I think some of the main theorists in that field that are well known and heard of are Pavlov, Skinner, and Watson. So there's been decades and decades of research done and formulating these theories and then being tested. So those basic research where tests and looking at relationships between particular events and situations and how it impacts behaviors has been thoroughly done, and specifically with the individual, not necessarily with group dynamics. So which makes it more practical when we are providing ABA services, typically it is to just an individual, that they are well researched and evidence-based. And that's the actual application of those theories to making positive changes in individuals' life. And they can be done with various different populations. So as I said, there's this, I guess, misnomer between autism being synonymous with ABA. And yes, ABA is definitely one of the services or one of the therapies that are very beneficial to somebody who has autism. But ABA itself is not limited to just autism. It can help individuals with acquired brain injuries, substance abuse, mental health issues, developmental disabilities, things like ADHD, anxiety. So there's quite a bit that ABA can be used for to help, and various different age groups. So I mean, for me personally, I've worked with individuals that were anywhere between 2 years old to 92 years old and everything in between. A lot of my cases through OCTC were a lot of dual diagnosis cases, which means basically that they all had some sort of developmental disability as well as some mental health issue. So there's lots of areas that ABA can assist with. So ABA utilizes those theories of learning, and individuals, we learn through instructions, we learn from modeling and from others and peers and from videos that we see, and from practicing and just interacting with others. And the other piece that's really important to ABA is that motivational piece. Why is it the person is engaging in those behaviors, or why aren't they? Motivation is very important. Usually has to do with accessing something. So whether it's accessing a preferred item, a person, activity, or is it escaping certain situations, types of environment, crowds, loud noises? So it's looking at those two factors when we're creating and developing strategies. So the professional practice of ABA involves multiple aspects to it. There's this assessment process that we go through, determining what are the goals that the family wants to meet, what is it that they're looking to make some positive changes in. Is it multiple domains? Is it certain areas like toilet training or emotional regulation? And we gather this information through some observation, assessments of the individual, maybe speaking to their teachers or other caregivers, maybe psychiatrists, psychologists. And then we write up some programs and strategies where we will implement them. Now, the implementation piece, depending on what type of ABA is required, and I will get into the various different ABAs shortly, it may require, at least initially, very intensive one-to-one therapy by an RBT or somebody's being overseen by a BCBA or BCBA AD. It may require implementation training of the mediators. So maybe it could be staff, it could be parents, and some one-to-one with a BCBA or RBT. But in some cases, it's more through the family, the parents and staff. And the entire process is always overseen and data-driven. So even the assessment, there's data being taken to get an idea of what are our goals going to be? What do we need to achieve to indicate success? And during the treatment, we're monitoring it constantly on a very regular basis. Okay, are these strategies, is this program working? Do we need to make some changes? Is it being implemented consistently? It's very, very important that these aspects are looked at to ensure that the programs are effective and meeting your needs for your child. Okay, so what ABA is not? ABA is not some very specific strategies or programs that are written out and doesn't require any sort of training or supervision. Somebody can just carry it out. Even when I'm training a parent to implement some strategies to maybe reduce some challenging behavior, there's always a little bit of training required. And as I mentioned, ongoing supervision and providing feedback. Okay, so what's going well, what's not going well. There has to be constant communication, observation, and changes if necessary to any program or strategies that are being utilized. Services don't have to be in a center. Very often when we talk about ABA comprehensive or that traditional IBI, a lot of that can be done in center, but it has been and can be done in the family home. It really depends on various different factors. Is it feasible for the family to come in? Is it not? Is the family environment conducive to providing therapy? Sometimes maybe there's just too much going on. There just may not be a designated area that can be used for one-to-one. So then centers is more appropriate, but it can vary. And it depends on the type of ABA. If it's challenging behaviors and that is the focus, it's something that needs to be done in the natural environment. So it has to be done in the home, or it could be done in the community if it's happening when the parent is taking the child to or the individual to community places like the grocery store or to the swimming pool or to a friend's home. Wherever it may be, we can focus the therapy on those particular situations. And the treatment doesn't focus on problems. We're not just trying to reduce challenging behaviors. We're always trying to build skills, because behaviors as I'll get into, serve some sort of function. They're communicating a need, and we need to fill that need with a more appropriate skill, a more appropriate means of obtaining that, whether it's accessing attention or an item, or is it learning to, use appropriate means of escaping from situations that they may not like. It's not a closed door therapy, so it's not just one-to-one, and there's no involvement with the parents. It's really important that whatever type of ABA it is, parents should be involved. They should be knowing what the targets are, how therapy sessions are going, what needs to be practiced, especially if there's sessions only once, twice a week. It is so important for that individual to make those changes and make those gains, that training and practice is occurring in between. And so that helps with generalization. So it's not just with that therapist or in that setting, it's also with the family, in the community, at home, wherever it may be. And ABA is not rigid and highly structured. Is it well, like it's overseen quite intensely and vigorously to ensure that things, strategies are being implemented and programs are being implemented correctly? Yes, but there always needs to be some flexibility and some changes to be made in the way, let's say, maybe a program is ran and presented. It might need to be adapted in a way that maybe will help that individual be more successful with it. And excuse me. And there has to be that flexibility, but also making it sure it's individualized in programs that are meaningful and target goals that are meaningful for that individual and their family. There might be certain words, if they're teaching language, that are more prominent and necessary for that particular family environment than maybe somebody else's. And as I've repeatedly mentioned, it's not a treatment that needs to be exclusively used just for autism. There's so many different diagnoses and areas. It's even used, ABA is even used in businesses to increase effective productivity, effective employees, and happier employees. It's all looking at, how can we put in strategies or change the environment in a way that staff or employees are more productive, more effective, are happier. And it could involve the way they're responded to, or what happens after those kind of behaviors we want to see more of. Who can benefit from ABA? So yes, as I mentioned, and I got ahead of myself, ABA can be utilized with different diagnoses, in different settings, different ages, different people. ABA happens in our day-to-day life. For example, I was so tired of always being the one to clean the dishes. It was always me. And my husband finally did it one time. And I told him, oh my gosh, I so appreciate the fact that you did that. It really helps me out. I find, it's just so much, and it just gives me time to focus on other things afterwards. Well, what happened was he started doing it a little bit more. Yes, it's communication, but also he felt he had a reward afterwards. He got that positive praise from me, and it increased the likeliness that behavior was going to occur. So what was the situation, the trigger? Dirty dishes. He cleaned them. I provided that verbal praise and feedback and hugs, and it increases the likeliness the behavior occurred again. Would any of us go into work if we weren't getting paid? No, that's the same thing. There's a certain need. We have to pay our bills and so forth. We do our work and we get paid. ABA is all about the ABCs of behavior. So those antecedents, behaviors, and those consequences, or I should say responses. It's what happens after those behaviors occur. ABEs also aim to increase behaviors that are important to the individual. As I said, that is one of the key important things. It has to be meaningful change, not just because society wants that, or certain behaviors need to obviously be dictated by the environment, like following rules in a group setting, as in students in a classroom. But they have to be something that's meaningful for them, and the change has to be what's to a level that is meaningful to the family. For example, very often we go with a goal of 80% or more change. Now, for certain, targets, like when we're looking at improving language and increasing the number of words that they have, that can be, that will be maintained 80% success on achieving those target words. Sometimes I've had situations where the target goal to reduce tantrums was by 80% or 90%. And even when we met a level of 60%, it was sufficient for this family because it had reduced the strain and stress that behavior was having on the family. So again, there's flexibility. It really has to be, at the end of the day, what is going to help that individual lead a productive and positive quality of life, and that will create a meaningful experience for everybody in that family or group. So as I've mentioned, ABA can be used to reduce behaviors that interfere with skills that are day-to-day. So if a child is engaging in behaviors and it's preventing them from learning skills, so like in school or even at home, if parents are trying to do work on reading, or working on toilet training, or teaching them to make their bed, sometimes challenging behaviors, escape-related behaviors, tantrums, and when I say escape-related behaviors, meaning that they're trying to get out of the instruction, so they're using, whether it's aggression or whining or throwing things to avoid those situations. It's so important that we reduce those behaviors, but then we have to teach that child, how do you meet that need? If it's to access things or to escape certain situations, how do you do it appropriately? Whether it's they have words or they don't, it's finding some way that they can make their needs known to others in a more appropriate way. And all ABA programming is always supervised by a board, a BCBA or a BCBAD. It's very important that they are overseeing it, to making sure that the therapist or parents, whoever it may be, are implementing those strategies with integrity. So we're making sure we're, getting the success that we're all looking at, trying to get to. ABA therapy. So finally, now I'm going to tell you a little bit about the various different types of ABA that can be provided. So I think a lot of people are very knowledgeable in the ABA comprehensive therapy, which was traditionally known as IBI, that one-to-one, there's a therapist, there's a child, they very often, but not always, will be working at a table. And it can be very, quick and intensive. It can also be done in a natural setting as well, during play, etc. Comprehensive ABA is usually directed at usually at least 10 to 12 or more domains at a time, and they're successfully going through various different domains. And when I refer to domains, it's there's specific skill sets that would be targeted, whether it's labeling items, understanding instructions, being able to do certain imitative responses, etc. And this is usually more intensive. It requires several more hours, usually something about 15 plus hours. And as I said, it's covering various different domains and skills. Focused ABA, as it implies, is very focused. It's usually no more than 1 to 3 goals at a time. And and the purpose of that is because that's all that's really required. There's some skill sets that the individual already has, and we're just looking at improving them while maybe reducing some challenging behaviors. So for example, focused ABA was predominantly what I did when I worked as a behavior consultant with OCTC and CHIO, the behavior management teams. We focused on decreasing challenging behaviors. And as I said, when you're decreasing a behavior, that behavior was fulfilling a need for that individual. So you have to teach them more meaningful skills to replace them. At the same token, some of those challenging behaviors may be being observed because of a skill deficit. So that's where, it could be getting dressed, or it might be being able to read, or whatever the skill may be. We're focusing on 1 to 3 specific areas, and there you're requiring a lot more support, not only support, but implementation with parents or caregivers. It could be staff to be involved. And therapy is usually something more along the lines of anywhere from 1 hour a week to maybe 3 hours a week. Again, so it really depends on what the focuses are, focus target behaviors are, and what the meters need. Sometimes there's more support or less support. Parent coaching is more just on a consultative model. Sometimes parents just need a little guidance in the right direction. They've tried a few different strategies, and I think sometimes having a third party come in and provide some insight as to changing a little bit of this, doing a little bit of added this is something that we can do. As well, there's been situations, so there are certain situations when a child is the age of 12 or older and has been deemed having the capacity to consent to treatment or not. If an individual does not consent to treatment, I can provide direct coaching just to the parent, or a BCBA can provide coaching just to the parents to provide support in maybe facilitating some changes that they would like to see. For example, I had an individual, she had schizophrenia, diagnosed with schizophrenia, ASD, and anxiety issues. She was 18, and she did not want to consent to treatment. So the parents, really, their goal was to get her to take her medication, to improve their relationship with her. And so through our parent coaching and consulting, I was able to provide them some support and how best to go about that. And it was more on like I said, consultative model, and something like that would maybe be a 1 hour a week, might be bi-weekly. It just varies on the needs of the family and the situation. What is behavior? So now know a little bit about what ABA is as a whole, and the key players, therapists involved, a little bit about them and the different types of ABA. I think it's just important to maybe give you a little indication about, information about what is behavior, because I think it's something that's, people hear the word behavior and assume that it's something negative, it's something bad, it's something challenging that we need to change. And behavior, it's everything that basically a person can do is a behavior. And if a dead man can't do it, it's a behavior. So it's reading, it's writing, it's riding your bike, it's getting dressed, brushing your teeth, throwing things, screaming, yelling. Anything you can basically see or do or hear is a behavior. So as I've mentioned before, a lot of our theories, or sorry, our principles are based on the theories of behaviorism, which is indicating that a lot of behaviors are learned. So they're not those inherent, reflex behaviors that we have. The large majorities of behaviors that we have are learned, which means that they can be unlearned. And so not all behaviors need to be changed. And that's so important that we look at, because sometimes, especially when I get families to track the data, sometimes they realize, oh gosh, this behavior is not occurring as much as I thought. So it's not as big of a problem. Or, oh, okay, it happens at a certain time and it's just a matter of tweaking something. Okay, so if he has his little break before we start doing his work, then he's okay. And some behaviors just don't need to be changed at all. I think a lot of parents, concern for obviously their children being stigmatized or looked at differently by others with some of their stims, so the hand flapping or the rocking, don't want their child to engage in that. And so I always try to present these questions like, is it interfering with their day-to-day living? Is it interfering with them learning or participating in activities, like whether it's family activities or community activities? Is it harming them or is it harming themselves? If you can basically say no to all of these, it's not a behavior that needs to be changed. Can we still make some adaptations to it? Yes, absolutely. Sometimes some of it can be shaped. Sometimes if children are making or scripting, and some of that, sometimes it's just that need, it gives them that sense, that ability to process the information that they've heard or something they've seen somewhere, or just maybe something that they like to do. Sometimes if we can be able to shape it so it's not happening, let's say, at a movie theater, they can do it at other times, and teaching them when they can and cannot do those things can sometimes be feasible. So looking at that, like, does it really need to be changed is really important too when we're talking about goals, and what are we changing and how much are we changing it? These are all questions that we collaboratively talk to the staff or the parents about what treatment is going to look at, or what assessment is going to focus on. So factors contributing to challenging behaviors. There are various different aspects that can affect challenging behaviors. It could be communication or social skills or skill deficits, period, that could be lacking. It could be genetic makeup. So whether it's maybe something that's maybe they're prone to sinus infections or seizures or asthma or some other, or reflux. Until those medical issues are resolved, it's really hard to make any positive changes in changing behaviors or developing skills until that is stabilized. So that's one of my key questions initially, is are there any presenting medical issues? What are they? Are they being addressed? Have they been stabilized? So it's really important to realize that biological issues or medical conditions can have an impact on behavior. The social and family environment. So there's so many factors there that could be impacting an individual's or child's behavior, whether it's the parents' relationship, the dynamics. Is there technology? Technology is a big thing in our world right now, with social media, with TikTok and social Instagram and Twitter and all the other apps and devices that are out there. But also peers. They learn from, individuals learn from their peers or their social group. Accidental rewards can happen very often, where misbehaviors, challenging behaviors are inadvertently, accidentally reinforced, and that's how they become perpetuated. And that can be is usually one of the more prominent factors, putting aside medical issues. The benefits of ABA. So as I've kind of talked throughout this entire presentation, ABA can benefit pretty much any age group. It could be neurotypical or not, different diagnoses, different environments. And we can help in so many different ways, whether it's trying to increase communication skills, whether it's trying to make family dinners possible, or family trips possible, or going out in the community, going to birthday parties. There's so many different benefits to it. Maybe having more time for your other children or for yourself, that it can really have such an impact, not only just on the individual level, but on more of the group level and the group family dynamics, or even extended group as well. And it's very much a collaboration. When you do have a therapist who comes into your family, it's really important that, I think, as BCBAs, we make you guys feel that this is a collaboration. We maybe have the expertise, the experience, the knowledge, but this is your family, your child, your life, and it's so important that the two work together to come up with something that's going to work for you and your family. ABA therapy is useful, but sometimes it's not enough. You know, as we know, human beings are very, very complex. So very often I've had to pull in maybe a speech pathologist or an occupational therapist, or maybe there's these individuals already providing services that we work collaboratively. Even when I work with psychiatrists, if we wanted to make any changes, we would hold off if the psychiatrist or doctor was making any medication changes, because then we wouldn't know if the changes that weren't occurring or are occurring are due to the strategies themselves, or is it because of some of the changes that the medication, the doctor might be making, or maybe some of the SLPs, in the very middle of a very intensive session. So some of that can overlap and continue. Some of it need to isolate and focus on one therapy at a time at times. But it's really important that we all communicate and collaboratively work together to really meet the needs of you and your child, or the individual in your life. And if you ever have any questions, please feel free to reach out to me. My email address is right there, my phone number and extension. If you'd like to find out how Spark can help you, and just let you know that Spark does have speech pathologists, occupational therapists. We do have social work, respite workers. If you want to contact me and we can talk about how we can help you, maybe it's ABA, maybe it's another clinician, but just reach out if you have any questions, even about ABA in general. I'd be happy to talk to you and help you. So thank you very much for joining me today, and I hope this has helped and provides you with some further insights on what ABA is and how it could potentially help you and your family. Take care.